Welcome back to my channel. Today we are going to have a chit chat with some coffee. Right now I have my iced coffee that I picked up, but after I let my skin settle, I'm going to get me some hot coffee. A few of the things I want to talk to today is, one is healthcare. What you may want to know about healthcare, or may not want to know about healthcare. But first we're going to go in and use the NARS Skin eye cream to get it to settle down, or to start off with, get our eyes all moisturized. And then I'm going to go in with that Awake Serum, a Glow Pill Super Serum. This is about $39, but you only need a little bit, and this has lasted me a long time. And I've been using this every morning before I put on anything else. So we'll let that sit out for about 10 minutes, and then I'll be back. All right, now that we have it all settled in, let's start with some primers, all the primers. So today I have the Smashbox Under Eye Primer. I've been using this every day. Love it. And then for regular primer, for the face primer, I subscribe to Ipsy's BoxyCharm and FabFitFun, and I got this, and I think it was the BoxyCharm, but I can't remember. It's this Marc Jacobs Undercover Blurring Coconut Face Primer. So we're going to try that today. So while we're trying this, I'll talk to you a little bit about healthcare, my struggles there. So I am on the qualities. It does have a little coconut scent, but not bad. It's good. Oh, I like how it feels. But I was a nurse for 10 years on the floor at the hospital, and then I moved up into management, but I do the quality side. So some of the things I do is investigate when mistakes happen and everything, or look at processes, or look at our scores, and all the data stuff, and try to figure out what I can do to improve the hospital. And one of the things that hospitals have, we have our federal regulatory bodies, which is CMS, the Centers for Medicare and Medicaid Services, and Joint Commission acts on behalf of CMS sometimes. So that's another regulatory body that comes and surveys hospitals every 3 years. The problem with that is hospitals, I'm not going to do my eyes right now yet, primer, until I get the foundation and everything done. So I'm going to go in with the Bye Bye Foundation Full Coverage Moisturizer by It Cosmetics. I've been loving this as well. And I'm just going to put some on. But anyway, so I do the quality side of healthcare, and we have this regulatory bodies. And healthcare wasn't really looked at for quality until 1999. I don't know if all of you know about this report, but I put way too much. I'm so busy talking, not even paying attention. That's all right. I'm not going anywhere. I'm back at my apartment in California for my job, because that's one of the things I do now is I travel to hospitals to try to, whenever there's a vacancy, and help them with quality when need to. Now, these sponges are the only thing that isn't going to be a high-end today. These are the Real Technique sponges. I do have this It Cosmetics brush. It's a skin hugging foundation, but I've never really tried a brush with foundation. Let's try it. I don't have anywhere to go. But anyway, so I'm back here in my apartment. So anyway, so In 1999, the Errors Human Report came out from the IOM. And it's a very famous report because it showed that around 98,000 people were dying yearly because of medical errors. But the problem with that, I think it's even underreported because there's so many times that when an error happens or a death happens in the hospital, people will investigate and figure it out. And sometimes it's very difficult to determine if there was an error, if it was the cause of death. So I think that's why it's even underreported. Some things are cut and dry and you can tell. But that doesn't even include all the adverse events that does happen. How many of you have either yourself or a loved one that had either a misdiagnosis or error that might have or might not have hurt you, but there was an error that happened to you, and I'm sure it's quite a bit. And the statistics is about 10% of patients will receive an adverse event, not necessarily death because of the error. So in 1999, they came out with this report. So that's when the federal government decided, or the government bodies, regulatory bodies and stuff, it really pushed quality, because back then healthcare was more fee for service. They got paid no matter what. Now in 1999 they started pushing for quality, but the problem is they're not doing it good enough, because here we are over 20 years later, and medical deaths related to due to medical errors is the third leading cause of death in the United States. And that's pretty alarming. And we're in 2015, Johns Hopkins did a study and showed that we're up to 250,000 deaths annually due to because of errors. And so that's pretty alarming. So all this push for quality, is it really working? Probably not. I'm gonna go in with, I think I got this again, and all my high-end products I did not buy because I subscribed to those three different things, and I did buy all my IT brushes, not this one, but I did buy a bunch of the IT brushes from Ulta a long time ago. But other than that, this is all in my BoxyCharm and Ipsy stuff. So otherwise, I'm a Walmart person. Anyway, this is the IT Cosmetics. This is color correcting full coverage cream. So I'm gonna go in with this. I'm not used to this. So let's see how this works. But anyway, so that's a lot, and like I said, I think it's underreported still. I don't know how they get these, because not every sentinel event that happens is really reportable, or a major event happens. And they're starting to make everything reportable to the state now, which is good. Yeah, back before, some things were voluntary, and things are voluntary to the Joint Commission. I think I'm going to go in with my sponge for my this part. But anyway, so after COVID hit, a lot of things have been excluded because of COVID. And I understand this situation, and I feel bad for everybody, and I don't know how to go about doing it is from a quality standpoint. But there is such a shortage of nurses and staff, and people wanting to work. They're burned out. They're over, and hospitals are understaffed too, and not all the time understaffed, but the efficiencies, the processes are so inefficient. And so I was at one hospital a while back, and this was after like maybe 6 months into the pandemic, and I noticed that there were so many people cutting corners because, again, they're overworked and overworked and shortage, and now you have to always be in, gown up into like, your, like if you ever seen like what was it with Dustin Hoffman, that movie, was it Contagion? I forget what movie it was, but they're in the room and they're dealing with the new virus. It wasn't Ebola, but I forget what the new virus was back then in that movie. But anyway, so they're all garbed up like that. Well, that's how nurses and physicians and everything have to be. So I understand. And when you're so busy, and it's not like some hospitals kind of cut down on the staff or the ratio for the nurses, but not all of them did. So now I'm going to go in with the LaRousse brush. This is the highlighter brush, but I use it for my under eyes, and the Bye Bye Pore pressed powder for that. I've been using quite a bit of it. I love it. Again, I got this. Obviously, it looks like it's a sample. But back to healthcare. So I get the how they need to cut corners. So I was up on the floor at this one hospital, and I saw some nurses do something, and I asked why they're doing that, and they said they gave me an excuse of like because of we don't have enough supplies to put in all the rooms, so they have to cut this corner here and whatever. And I'm like, well, let's look at a process. We need to fix this process because we can't cut corners. We still have to. That's where errors occur. And see, I don't think everybody. I'm going to go in with the the Tarte Shape Tape setting powder, and I'm going to use my IT brush. I think this is actually. Oh, it is a powder brush. I don't know how you add. I still haven't figured out this mesh thing and with it. Actually, I think it was Allie Glines, one of the influencer, actually cut the mesh, and so that they could actually get it out. I'm like, genius. So I think I might do that. But anyway, so I went to the leader of the hospital, and they said, this is just an accountability issue. This is I'll deal with it. And if anybody sees it again, they need to just tell me. And I'm like, no, it's a process issue. And I don't know how many times people argue with me, but see, one of the problems is, as a director, I'm responsible for the whole hospital, really, from regulatory and anything that happens in errors. So even though I'm not a CEO, I'm still responsible for the entire hospital. And I care about my patients, and that's why I went into this side of healthcare after becoming a nurse, because I thought I would have a voice. But they put these quality directors. I'm going to go in with the Natasha Denona palette. I don't know if I'll use only this palette. I have a couple other palettes that I might dip into. The Modern Renaissance Anastasia palette that I just received in, I think it was BoxyCharm. And then I also have this Seraphim Botanicals, the Sakura Sage palette, which I used in one of my other videos. But I might go in with that gold shade. I really like that shade there, that glitter shade. So we'll see. But anyway, so anyway, so what people do is they put and I'm not saying this just because, oh, I gotta put eye primer on. And I'm gonna use the NARS eye primer. I've had this forever. I'm just gonna put this on. I'm sure it's expired. I've had this for a long time, but I don't throw anything away, which is weird because as a quality person, in the hospital, if it even comes, that is one of my jobs. I make sure there is no expired supplies in the hospital. And because if Joint Commission, when they come to survey, which again, they only come every 3 years. I wish they came more. So, and they did a more thorough job, because many times I will be like, okay, Joint Commission's coming. I'm going to finally be able to get this buy-in from this, because they're going to find this and then they're going to have to fix this issue. But they have like 4 days to find all these issues. A lot of times they don't end up finding it. So it's, I'm going to go in with this blending brush by LaRousse as well. It's the LR005. And I'm just going to probably go in with this here, this shade here for the transition shade. But, and then they end up not finding anything. And I'm like, oh my goodness. So then, not only does it make it look like, see, Jamie, we didn't get cited. Or, and that's the other thing. Oh my gosh, I don't know how many times people will tell me, well, we passed this with the Joint Commission this way, or last time, or whatever. It's like, well, okay, it's been almost 3 years, and you might have just got lucky, but this is the regulatory. Or if they did look at the process, sometimes they just care about the process, or that you have a process in place, not necessarily if it's good enough. So we have to evaluate physicians, and there's metrics that you need to evaluate physicians, and you need to have a process. So at this one hospital, we do have a process, and they're like, well, we passed Joint Commission, we have a process. This meets Joint Commission requirements. And I always tell people, is that your goal, is just to meet Joint Commission? Because you can, I think I'm going to go into the Anastasia palette now, because I'm really looking at this Love Letter shade. It's kind of coming out, it's talking to me. Well, not really talking, but you get what I mean. So, and I'm like, we need to have not just what meets Joint Commission requirements, but what is the best process? Let's have a really good process, especially for our patients. We want to make sure, because that's the whole reason why we have to evaluate physicians as well, because you can't just have physicians coming in and they make tons of errors and take care of patients and just keep allowing that. I mean, that's how we hold physicians accountable as well. But you got to have a good process, and nothing that just, oh, well, we passed Joint Commission. I don't know how many things that I've saw needing an improvement, and they're like, well, I met Joint Commission, and I get pushback. Again, oh, what I was saying way before, sorry, I kind of am all over the place, but they put the quality director at a lower level. So a director sounds like it's, you know, a high level, but is it really? So here, as a director, I'm dealing with directors, trying to hold them accountable with no authority. The C-suite, hold them accountable with no authority. The CEO can only do so much, or get in the weeds so much. And that's the other thing. I've had CNOs hide things from me because she did not want anybody to know. And I don't know why people think that, okay, just because I'm coming up, I think I'm going to go with this Venetian red shade for my, right here. I don't know why when I bring up that something needs to be improved, that people get like all defensive. So I was going to do this FMEA at a place. And that's a failure modes and effect analysis. It's a proactive tool. When you identify a risk that might happen, that you put a plan in place and find any failure modes that could happen, and you have a plan for it. So I'm like, I identified an issue and I brought it up. Everybody thought it was a good idea. And then the night before, and this was on my calendar for 2 weeks, the night before, the risk person asked me, where did this come about? And this is risk. Risk in hospitals really are more reactive than proactive, because most of the people in risk that I've seen, and I've been at a lot of hospitals, this is just, it doesn't have any product on it. I'm just kind of trying to blend this out. And they're what I've seen happen, I don't know if they have this mindset or what, but when they wait until events happen, and then they do a root cause analysis and which is a way to figure out what happened and put a thing in place so it doesn't happen again. But the problem is that's being reactive. Healthcare is so reactive, and I've been trying to get healthcare to, I don't know what shade to go in with next. Let me see what we have in. I'm thinking, okay, in the Seraphine's palette, I'm going to go in with that gold shimmer shade that kind of is crumbled a little bit. But, so anyway, back to healthcare. I don't know if you guys are really interested in this, but it really bothers me. But, so, she calls me up, the risk person, and wants to know what's going, like, where this came about. So I talked with her, and she's like, did this come from an incident? I said, no, but a physician brought some concerns to me, and it's very concerning to me, so I suggested we do an FMEA. And yes, I'm an interim person, so sometimes that makes people don't know. When you're working interim, people might not know your qualifications or think you're qualified and all that. I get that. But this has been on my calendar for 2 weeks, and they're like, and she's like, well, we're already working on it in a committee. I said, well, in committees, who's on those committees? Now we're gonna go in with eyeliner, and this is the Seraphine Botanicals Lunar Liner Water Resistant Eyeliner. It's got a shorter thing there, so let's see how this goes. And I was watching Babs Beauty, and she kind of, because as you all know, I'm horrible with eyeliner. And she kind of, you know, holds her face taut and does this. But then, you know me, I have to shut my eye and do it. Wow, I think that's one of the best eyeliners I've done. Okay. But anyway, so I explained to her, and you know, well, we need to be proactive, and that's what an FMEA is done, and I offered to do it, and they were actually due for it. Oh, they're not even, but you know what? That's the best it's gonna get for me. But she's like, you know, and they were due for one, because Joint Commission only requires one every 18 months. But they don't really look at the quality of it either, because I've seen really bad, poorly done, just check the box type FMEAs, and just to get it done. And it's like, you didn't even do it right. You didn't even include anybody. Like, a lot of times the quality director will just fill it out and send it through the committee, because Okay, next I'm going to go in with this Lancome mascara primer. So they don't really do it right in healthcare, and I can't believe Joint Commission only requires one every 18 months when it's a proactive tool. But people don't do it right anyway. I've seen so many people, like I said, the quality director just does it and doesn't include anybody. And that's the other thing. A lot of times in these committees, I said, who's in these committees? Leaders. So you're having leaders work on these issues and not the frontline staff who knows the barriers, who knows the issues. They need to be part of these conversations. And there was an article I read that, like, and I know this already, but it kind of reiterated that people are going to be resistant to change when it's forced upon them, but they're going to accept change. And this is what I tell people. They will accept change if it's their idea. That's another reason why I'm just using this It Superhero mascara. And I don't know how many people don't really realize that. And leaders will make excuses that they have a budget and that's non-productive hours and that will make them go over budget. Well, healthcare needs to start incorporating a non-productive PI budget for performance improvement. I'm just going to go with under my eye with this love letter color that looks so pretty and go under my eye. But anyway, so, you know, I get so much resistance to it, trying to make improvements, whether it's because of, you know, people are very territorial too. So I don't know, like I said, I don't know if they're worried that they're going to be identified that they weren't doing their job and they're going to get in trouble, or what the issue is. Because, so when I worked at a system, I was the PI person, and we got bought out and they acquired me. So they didn't have a PI person. They thought, oh, well, this is a valuable position. But the problem was they didn't know where to put me under the quality umbrella, because the VP of patient safety and risk and infection control, which I've done and I know a lot about and I could do, she didn't want me touching her area, which is a lot of healthcare, because she was territorial for whatever reason. And then, okay, I'm going to go in. I just, off camera, I did my lower lashes, and then I went in with this Wonder Beauty Jet Black under my eye. So now I'm just going to put this shade Vermeer and go under my eyebrow, kind of put that shimmer there, and then on this side, and then go in with my brush and kind of just do this. It's so funny. I don't know if it's called this, but I love it, and I've been calling it that. Ellie Glines calls it, let's do the scoopity boopity or boopity scoopity or something like that. I think it's so funny, so I've been calling it that. And even though I'm a nurse, I really don't know I forget what the terminology is for that. But anyway, now we are going to go in with our eyes, and this is the IT Cosmetics brow, your brows but butter. So again, I'm not very good at this, so I will try and see how it goes and outline. But so yeah, I mean, healthcare, back to what I was saying, sorry guys, but they think that it's a bad thing. Like, they're either not doing their job, or why is somebody else doing this, somebody else? And so as an interim, when I suggested the FMEA, I really think that was it. Because after they had me cancel it and everything, that day people were like, why was this canceled half an hour before and whatever. And I'm not one to throw anybody under the bus, but I just said I was told to cancel it. Sorry for any inconvenience, because I was actually going to get front line there and stuff. So I'm going in with the hula. I know, again, this is a dirty box because of the air, being in my suitcase. But I really like this hula bronzer. And again, I'm not one to throw things away. But especially if it still works, And I don't know how long I've had it. I've had a lot of makeup for a long time. And for a while, I didn't even wear makeup because it was too time consuming. And then the mask and, and working on the floor as a nurse, I didn't really wear makeup either because of the mask, and I didn't, I guess. This is the, again, the Complex and Culture Press and Set Bronzer brush. I love this brush. But then for my nose contour, I use this IT Cosmetics brush. It was one of the first brush sets, so that's why it looks really old and it's starting to be frail. But I love it for nose contouring just because it can. And I had some, but I forgot. We'll have to do that next time. And then just kind of. Alright, so now I'm going to go in with my NARS highlighter brush and the Ofra Glazed Donut Highlighter. So anyway, I have a struggle with people having that. Ooh, I like this. I don't know if I've used this one. I think I used the Rodeo Drive one. But anyway, so people, I just have a hard time with people getting past that connotation. So now I'm going to go in with the NARS Orgasm Blush. I love this. It's almost empty. And I have another one at home, but it kind of broke again in my luggage, but it's just cracked, so I can still use it. But I don't want to travel with it because it'll probably get all over. So I'm just going to keep that one for at home whenever I go home. And usually I put my blush on before my highlighter, but I forgot. But so one of the things that I had an epiphany with is, and it'll never happen. And it's not that I'm trying to make myself get more money or higher, but until they put quality above everybody in the hospital other than the CEO, we're not going to make improvements. And because we have the authority, or we have the responsibility, but no authority, and I don't know how to make that happen because I'm one person, but I struggle to get things to make sure it happens. And I get there's budgets, I get there's everything, but you know what? In the long run, you're going to pay more by penalties in the hospital, star ratings that each hospital has a star rating. I don't know if any of you knew that. So you could go to Hospital Compare and look up the star rating of the hospital, and that's all based on the quality metrics. The problem with that, I don't understand. There's hospitals that have a 1 star, but yet then they'll have an A in Leapfrog. And Leapfrog is another measure that I'm going to go with the Huda Beauty Lip Contour liner. And a lot of the metrics are the same. There are different metrics. But how can a hospital be an A in Leapfrog and a 1-star? If anybody knows CMS or has contacts, have them look into that, because that really bugs me. And then I have this NARS, and I don't know if I like this color. I'm not a big red person, and I don't know if I'll match with this, but you know what? We're going to go with it. Like I said, I don't have anywhere to go. And, because there's some issues there. And it's got to be confusing to the public, if they even know to look up the Leapfrog scores and the CMS scores. So, well, that dried down to a matte, which I don't like. So I found some Violet Voss, like a clear lip gloss. So until healthcare really decides to give quality more authority and put them over everybody else. So I'm thinking, you know, CEO, the quality person, and then the rest of the C-suite. Otherwise, it's never going to happen. Nothing's going to work. Because all I do is fight for improvements and fight for the staff and look at efficiencies for them. And so their job is easier too. And, you know, I get so many pushback of whether, you know, it's their job, not mine. And it's like, okay, so I'm a different department. I'm not qualified to do it, you know. So it's very siloed in healthcare. I'm going in with this Tarte Double Duty Beauty Stay Spray. Ooh, the mist is nice on this. So that is my overview of issues in healthcare. I hope you enjoyed it. If you want to hear more about healthcare and what to know about and what you can do about it, please drop a comment, and I will do another chit chat, coffee video with me, and I can tell you more about healthcare if you want to. Have a great day.